What happens when we choose to place differing values on life based on perceived worth to society rather than respecting the inherent humanity of all individuals? Dr. Michael Robertson's work focuses on the Nazi persecution of the disabled and its relevance for current issues in practice and policy.
Many have looked at the Nazi period and what steps enabled the crimes perpetrated under the Nazi government by the medical and nursing professions. And consistently, the observation has been that the first step was permitting a relative valuation of life. That is to say that some lives were of lesser value and lesser worthy of consideration than others. Indeed, the early writings in eugenics used the term life unworthy of life. When we consider this as the first step in mass killing of the sick and disabled or genocide of the Jewish civilization of Europe and other victim groups, we have to continue to question whether our public policy and our cultural norms assume that there is a relative valuation of life. During the COVID pandemic, the most vulnerable groups to the disease have been the elderly and those living with chronic diseases, people with severe and moderately severe disabilities, and certain ethnicities. Now, public policy decisions haven't necessarily sought to directly target these groups. However, when we consider the death toll and the morbidity associated with COVID-19, it has disproportionately affected groups who historically have been judged as being having lives of lesser worth. And again, this is not saying that public policy decisions are just what the Nazis did, but rather require us to question whether or not our public policy and our social institutions operate on the assumption that some lives are of lesser value or less worth than others.